Welcome back. You're watching the front row. We're on to our last bit before we wrap it up here. Let's get back to our guests, and I'd like to come to you now, Dr. Nanyingi. The whole conversation right now after Nairobi, Mombasa, and the other counties that were facing the lockdown, or where the lockdown was imposed, things have been opened up. The responsibility has now shifted to the counties. Reports now show that counties said they had 70% of the counties were well prepared, but we're getting new reports that only 5 counties are prepared. What does this mean?
I think it just echoes the sentiments of previous speakers that for us to have succeeded to contain the pandemic, there's a need for risk assessments or properly instituted preparedness and response plans. And this has to go county by county. So in terms of assessing the capacity, whether it's a healthcare capacity to know, do we have enough healthcare workers actually to handle this? Do we have enough bed capacity, whether it's isolation units or whether they're ICU units? The spread of this disease, when you look at it, it has been progressively moving from one high-risk county to the other. So if this would have been done much earlier without actually disrupting the routine, programs, the routine healthcare programs, the capacity in terms of assessing, do we have the diagnostic capacity, whether it's a human or infrastructure laboratories in some of these areas? Do we really, have instituted the issues of case management? Are we adequately trained to have people of high caliber in all these areas? And a key thing actually is in terms of the infection and prevention control strategies, and also putting the PPs in perspective. So the issue of risk assessment and preparedness, this has to be done, was supposed to be done much earlier, so that each county would have been assessed much earlier and given actually like a check, whether we are okay, whether we are not. So we are in the middle of a pandemic, and now we are also trying to aggressively at the same time do the risk assessment and preparedness and planning. And this is going to be, like a backlash. So I think we needed to have done better, and I think there's still time to learn from these failures and mistakes to do an earlier emergence preparedness and response strategies that actually help the entire country.
Some of these restrictions that were put in place, curfew, lockdown, restriction of movement, you name it, how effective have they been? And did they buy counties time from where you sit?
I think it depends on the approach. So when you're locking down people, what you're aiming is actually to flatten the curve. But when people are actually finding loopholes into this lockdown system, and that basically means that it's not going to be effective. So I think the primary intention of the primary goal was actually to suppress the spread and actually limit the transmission between counties. But as we see it, we didn't do much good in terms of that. And actually also what Nyamongo talked about, when you start lashing at people and using punitive measures, then now it becomes the role of the public against the state. So when you have this kind of antagonism, and then you realize that the buy-in for the people, and even tailoring this risk communication messaging, it becomes a defiance in the population. So the failure actually to have compliance issues where the public actually understands that this is a disease that will affect us, stemmed all the way from the risk communication strategies that were built to institute proper behavioral communication change. And I think that's where we need to continue working on it, and actually people to realize that this is a really serious issue, and the government actually also to allow the public to participate in the entire process.
Right, there's room to work on that, as you say. Dr. Nyamongo, how counties have behaved so far in preparedness, in just putting things in place? Is it a hit or a miss for you?
I think for me it's a miss. We waited as a nation. From January, we did a few things. In March, we announced some measures. And then counties seem to have been waiting. And now we are talking about community spread. You see counties beginning to ask whether they are ready or not. I think we had 4 months after the first case was announced in this country for counties to start putting measures in place. Secondly, Akisa, I have a major issue with the way we are assessing county preparedness. We cannot only be looking at bed capacity. We've talked about a pandemic being 20% medical, 80% community behavioral. we should be focusing on behavior change. We cannot be saying this county is prepared because it has 300 beds. No, I don't think that's the way we need to be assessing preparedness. Our people understanding the need to physical distance. People understanding why they need to wear masks. You go out of Nairobi into these counties and people are not wearing masks. You go to Kakamega, you drive from Kisumu all the way to Busia. People are not wearing masks. People are attending burials. People are going to markets. Life is normal. So if we are going to be prepared as counties, we need to ask ourselves what measures have been shown to work against COVID-19. And we know physical distancing works. We know that wearing masks works. We also know that washing hands and sanitizing works. So can we, as county governments, begin to look at the behavioral aspects in as far as prevention is concerned, at the same time as we begin to prepare the health facilities to take on board this?
Right.
Thirdly, Akisa, is we do need to encourage people to go to hospital for other health seeking. For other health problems, maternal health, HIV, malaria is still going on. So even as counties prepare, can they designate a facility that will be dealing with COVID-related issues and encourage families and communities to go to hospital, so that we do not have deaths and illnesses that are unattended because people are now scared to go to hospital. So it's very important to think about that. Lastly, Mercy talked about community health workers. This is the time counties need to bring community health volunteers on board. We cannot now start also addressing people from the county headquarters. We do need to work with community health volunteers. We need to work with community leaders. We need to work with church leaders to ensure that people get information. People are encouraged to adhere to the restrictions that the government has put in place.
Right. Dr. Korir, Dr. Nyamongo here says preparedness is not just bed capacity. What are your thoughts around how the counties have behaved so far?
I think the counties behaved business as usual, where, you know, you do the photo ops of the tangible things, the beds, the buildings, you know, and you say we are prepared because we have 10 beds we have put in here. They forgot that this disease requires the people. It requires more of a community approach as opposed to the hospital-based approach. And I think if we had put 80% of our energies and our efforts into the community, provide the community with tapped water, for example. This was the high time to actually provide people with running water, for example, because we know hygiene is a key component of COVID-19. Then maybe we would have gotten somewhere. But this approach of, you know, trying to show the optics of a building, of a bed, of a ventilator and whatnot, for me, we missed the point there. There could be other motivations for that, but we missed the point. And then when it came to preparing the facilities, because ultimately you still need the facilities, we've gone heavy on procuring commodities, items, equipment, and we forgot that these things need human beings who have been qualified and trained to run them. For example, if you install a ventilator and you do not have a qualified critical care doctor to manage that facility, then you have really not done anything for that. So the county missed on that point, that they did not focus on the communities. They're still not focusing on the communities. And when it comes to care personnel, they've not employed the requisite personnel who would actually help them on the other spectrum of the disease. That is when people go to hospital in need of critical care.
Okay, and because I'd likely now come back to you, Dr. Mercy, your closing remarks, are we on the right track? How do we move forward quickly?
For me, how we move forward goes to the individual responsibility, because we've seen that really government is not able to do the things that they are supposed to do to safeguard us. So I think moving forward for me is an individual responsibility, that you take care of yourself, because taking care of yourself means taking care of the other person. The last one is that, remember, it is not the virus that moves, but people who move. So our movements, especially if unnecessary, will just spread this virus far and beyond. So take individual responsibility, because I don't think we can really rely on government, because some of the decisions they are making really are not taking us in the right direction. Great.
Thank you very much. Dr. Nanyingi, your closing remarks and perhaps going forward, what should we be very keen on?
I think the first thing is we need as people to destigmatize this disease. We need to actually have the right communication strategies where people have to take personal responsibility and the issues of compliance and have discipline actually to follow all the laid down public health regulations. But a very important thing on the side of the government is actually to invest in research and development, invest in science. Capacity building of healthcare workers and people in research is very key. For now, we need to move ahead and actually conduct large-scale epidemiological surveys where we can, understand how much the disease was exposed by, finding the antibodies. And finally, the government doesn't own the disease. The disease actually is a public problem. So when the government does not want to share data with, researchers and other institutions, and then actually it clouds the whole potential of the public-private partnerships in research and development.
Okay.
So we invest in research, and finally, we need also to move to invest in pharmaceutical and therapeutic development and vaccine therapy. And finally, people shouldn't listen to everything that they find on social media about hydroxychloroquine and all that kind of things. We need to be very careful on what we consume on social media, because that is how pandemics actually explode. Thank you very much.
Thank you, Daktari, for mentioning that last point. Very important. In another conversation, I will set up a whole conversation around that and all these theories around it. Dr. Nyamongo, you get to have the last word, your closing remarks.
We need to really focus on the poor. All these measures that we are putting in place, some of them cannot realistically be implemented by people who don't have food, who cannot afford health care. We cannot, as a country, not focus on the poor in this country. Secondly, we need to tailor our messages to the different categories of age groups affected by the disease. I think the children and the youth have been left out. So a focus on the youth, bringing youth into the center of this conversation, would be very useful. For counties, my call on all county leadership, as we focus on bed capacity, ensuring that we have healthcare providers in place, people who can run those facilities, we need to pay more emphasis on people themselves, on the communities. We need to encourage people to do physical distancing. We need to ensure that we have people wearing masks. It's very sad when you go to a market and people are operating like as usual. Let our communities understand. Let's work with community structures to sensitize communities, to rationalize why they need to take the measures the government has proposed. Right. And let's see that working as we prepare the health facilities to accommodate those who eventually will end up in the health facility.
Thank you very much, and that's how we wrap it up here on this episode of the Front Row, looking at the hits and misses by the government in the handling or the response towards COVID-19. Our guests on this episode, Dr. Mercy Korir, a medical journalist here at the Standard Group, Dr. Mary Nyamongo, Executive Director of the African Institute for Health and Development Kenya, Dr. Mark Nanyingi, a public health expert as well as an epidemiologist. And we also earlier on spoke to Eddie Orinda, a lawyer and working on a paper on legal epidemiology, and of course giving us a first-hand experience for someone who tested positive of COVID-19, him together with his family. We'll get all these episodes online. Thank you for also engaging with us on slido.com, on Facebook, on Twitter. Glad to always have you here with us. I am Akisa Wandera. I'll see you next Tuesday on the Front Row.
This is KTN News.